Hello, everyone. Welcome back again to Nursing and Therapy by Adobe Okoye, and this is my podcast. Okay, so today we have a very common but yet important topic to talk about, which is sore throat. So, a lot of people get this pain to their throat and they usually feel anxious about it. Okay, so I'm going to discuss it today, and I'm going to try to be very brief but then explain some things as well. Okay, so sore throats is usually or their pain in the throat or to the throat that you feel when you're swallowing anything, whether food or fluid. They are usually very painful, but then you don't have to worry about it. It's common, so you don't have to worry about it. And it's also important to let you know that they get better by themselves, usually within a week, especially when you're doing something about it. Now, this topic is I'm highlighting the importance of doing something about your sore throat instead of just being anxious or ringing your doctor or visiting the hospital just like that. Okay, but before we start, I also want you to know that sore throat is like an umbrella to a lot of things that could be happening down there, in your throat, like tonsillitis, which is very common, laryngitis, strep throat, glandular fever, a lot of it. Okay, but then, like I said, it's like an umbrella. So, but just start doing something about it, and then if you don't get well, you can then go forward to ringing a doctor or going to the hospital. So let's start with the causes of sore throat. Usually they're caused by viruses. Just like when you feel this cold or flu symptoms, there's some that could be caused by bacteria, but then virus is the most common causes of sore throat. Okay, so there are symptoms you usually feel or get when you're having sore throat. The first one, which is very common, is that pain when you're swallowing. This pain actually makes it difficult for people to eat or drink. They get scared because they don't want to feel that pain. That's the first symptom you get when you've got sore throat. And then you feel like your throat is itchy and dry. It has this gritty feeling, like someone is scraping your throat. It's always dry, that something is happening down there. It's a symptom of sore throat. And then when you take a mirror and then look into your throat, like looking in your mouth, you're able to look at the back of your throat. You'd see that maybe it's red and it could be inflamed or swollen, and you could even see some white patches. All right, and then another symptom is mild cough. People get cough while having sore throat because that feeling, like I explained, when your throat is dry and you're uncomfortable, so you tend to cough just to get that comfort. Okay, but the comfort doesn't come, especially when you're not doing anything about it. So, and then some people go as far as getting the swollen gland, neck gland. So there are things you can start doing that should help you feel better. And then if you don't feel better, that's when you should visit the hospital or ring your doctor. The first thing is start the salt and warm water gargle. So this is I can't overemphasize this because it's the first step to making you feel better when you've got sore throat. And just know that this salt and warm water gargle is not going to cure this sore throat. It's just going to make you feel better. Okay, so I'm going to explain how this happens, like how to mix this or what you should do. The first thing is try warm water, not hot water, because of course if you use hot water it would burn your throat. So warm water and salt. So you can use when you get a teaspoon, just quarter of that teaspoon into like half cup of warm water, dissolve it. Like salt water is hypertonic, and so when you dissolve it, and the warm water is actually going to help to dissolve the salt. Yeah, and then when you take this warm water and salt, when you gargle, it helps to draw out that salt helps to draw out the virus that could be causing this. As you're spitting out the water, you're spitting out whatever is causing it. So the mixture, the warm water and the salt, both of them act, they just help. Just know that it helps. Now I'm trying to explain this and so that people will understand. So this remedy, you can do it 2 to 4 times in a day. It depends on how free you are. So if you're going to work, you can do it before you're off and then when you return. But if not, if you've got the chance to actually do it 4 times, why not, since it makes you feel better. So, and also know that as you're doing, you know that salt is very drying. So as you're doing this, be drinking plenty of water. Okay, so now, like I said, salt and water, that's the first step to managing sore throat at home. Then drinking plenty of water, drink as much as you can. Then try to eat anything that's going to soothe your throat, anything that's going to cool it. Before I forget, please, if you are hypertensive, I don't recommend this salt and water. There are other things I'm going to say here that can also help. So if you're hypertensive, please don't try salt and water. So you can also eat some things that cool water, and you can have some ice cream, and as well eat some foods that are soft, that can easily pass through the throat instead of hurting yourself when you already feel pain to that throat. Okay, then I know people go as far as getting this lemon drink or things like that, but this is something that you can actually do at home. You can get honey and lemon and ginger, blend it and then drink. They're natural things. I actually advocate for natural things. So you can blend and drink because it contains antioxidants, anti-inflammatory and soothing ingredients that could actually help make you feel better, even some antibacterial effect as well. So then if you can, take some paracetamol to help with the pain. Also remember that paracetamol is to be taken 4 to 6 hourly. Please don't overdose yourself. So it helps with the pain if you can tolerate that. So you can also try over-the-counter lozenges like strepsils. It also helps with the throat as well. Please, before you take these medications, read through the patient leaflet so you take as recommended. Okay, so but if you've done all this and you've noticed that from the first day you started, like say 24 hours to like 72 hours or more than that, just give yourself 2 to 3 days and you're not feeling better, nothing is improving, please see your doctor. Then if you notice that almost every month or every time you're getting or having this sore throat, please see your doctor. I mentioned earlier that some sore throats are not viral, some could be caused by bacteria. So in this time, like in this instance, you need some antibiotics to help you with it. Okay, and then if you've got this sore throat and then your temperature is very high, your body is very hot, you feel sick, you're vomiting, you could be having diarrhea, you're not just yourself, please see your doctor or ring your doctor. And also don't forget to take a COVID swab because it could still be COVID. So just ring your doctor and then follow up with the treatment. Okay. So we're done with the sore throats and I hope you've learned something from it. And I just want to add the benefits of drinking water. I decided to add this topic because I noticed that most times water is difficult for people to consume. People find it very difficult to take water, probably because water is tasteless. Water is natural and it's supposed to be tasteless. It's not supposed to have a taste, but then there are things you can do actually to improve the taste and help you drink water. But here I just want to talk about some benefits, just very few benefits of drinking water. I'm going to start with water helping you to regulate your body temperature. I'm going to give an example with a car that is overheating. So you're driving a car and then you notice that it's smoky and then you pull over, just open the bonnet and then you're seeing that it's smoky and then you're looking for water to help cool your car. It shows you that you have overworked that car. So that is exactly what happens to your body when you're not drinking. So your temperature rises. You may think that you're feeling sick, but you're not feeling sick. Like it's not like something is wrong with you. You just need water to cool your body, like to cool your temperature. So I just use this as an example. A car overheating, and then your body overheating, because you need water to help you regulate your body temperature. Another benefit of drinking water is that it helps to, kind of keep your mouth moist, or even help to create your saliva, because there's some instances that you talk and talk, then you feel dry, but then when you take some water, you see that your mouth is moist again, and then you're able to, you feel yourself, you're able to communicate again. So we all know that water helps in excretion. So when you take water, it goes through your system, and then you can, sweat and urinate to take out the waste products, and also helps you to, open your bowels and, defecate. So that's why it's also important that you drink water to prevent constipation. So what am I trying to say? Water helps in to prevent constipation, as well as it helps also to digest your food. So as you're taking water, is digesting your food, is also helping you to prevent constipation. Okay. And I have a very this one is more it's also practical, just like I've been explaining now. Imagine coming back from work, and then you feel very tired, and you need to sleep, or you're just tired, your body's just, let's say, let me use the word scattered, and then you get to the bathroom. That feeling when you just pour water on your body, you feel good, like you feel like you don't want to leave this bathroom. If you have a tub, you slide in there, your mood has improved. It helps to improve your strength or your energy. So overall, water is good. Just prevent or avoid dehydration. So when we talk about how much we should drink, it's important to note that you don't just drink water when you're thirsty. You should drink water. You should be intentional about drinking water. So according to the National Academies of Sciences, Engineering and Medicine, it says that for men, they should have about 16 cups of water, and for women, they should have about 12 cups of water in a day. So, but what is this trying to tell us? It's just trying to say that you should drink as much as you can. You don't have to drink only when you're thirsty. Be intentional about water. Okay. So I made a statement earlier that a lot of people find it very difficult to drink water. Now, there are some ideas that I have for you that you can also use it, and then you're able to monitor your water intake, especially when you know that you're not able to drink water that much. Your reason could be because water is tasteless. So if you feel like you're struggling with drinking water, there are tips to that. Some people get like juice, and then just pour out a little and then top up with water. But like I said, I'll always advocate for natural things. So what you can do is you can get fruits, then squeeze out or blend, and then top it up with water, just to make your water have taste. Okay, just to ensure that you've got this taste. If you're struggling with drinking water because it doesn't have a taste. Another thing is just ensure that you carry your water bottle wherever you go to, no matter how little it is. Just carry it wherever you go to, and ensure that you've always got water in there. Okay, so I know that what people do these days, there are some water bottles that they're kind of calibrated. They've got this times, just to be intentional about drinking water. From 9 to 10, let's, for instance, a water bottle could be about 1 liter, and then from 9 o'clock to 10 o'clock, you should drink about 100. It's calibrated, so you can also get it if it's going to help you. You can also get it if you know you're struggling. You mustn't even be struggling. It's just about being intentional about drinking water. So if you're very intentional about drinking water, so you should get this water bottle just to monitor yourself and how much you've drank in a day. Okay, so just get the water bottle and keep monitoring yourself while drinking the water. It's very important just to hydrate yourself, and then just feel good, function effectively wherever you are. Okay, so I just want to also add that as much as you're drinking water, when it's almost your bedtime, you don't have to drink a lot. Not like the water is not going to be good for you, or like it's not going to work in your body. No, but then because you're sleeping, you won't want to interrupt your sleep. You just want to sleep peacefully and then wake up, even if you have to wake up to, have a wee. Not like you keep waking up every time. So you don't have to drink too much when you're getting close to your bedtime. You just have to drink, and then just know that you're going to sleep. So you don't have to, or you're going to bed and you don't want your sleep to be interrupted. So just don't drink as much as you drink in the afternoon so that you have a good sleep. Okay. I think this is where we're dropping this for now. Thank you guys for always listening and for always sharing. And my subscribers, I can see you. Thank you also. Thank you very much for subscribing. And I just want to encourage you to keep listening and keep sharing. And I believe that whatever you learn from here is going to be very important, even if it's not for you, maybe to someone that is very close to you. And you can always drop your questions. You can always ask your questions. If you want to know about a topic, you can just drop the topic and then would prepare the topic and then present it for people to listen to. So thank you very much, guys. My email address is zenythealth@gmail.com. Is always is up there on my podcast page, so you can always see to ask your questions. And like I said, my name is Adobe Okoye, Nursing and Therapy Podcast. Thank you very much and see you some other time. Bye.